where you ask me any health questions and then I answer them for you. So if you're new here, welcome. I'm a naturopathic doctor, so my main focus is on holistic health. So that basically means focusing on the body as a whole, using natural remedies, herbs, and supplements to try to heal the body. So I've been getting a lot of great questions on this live stream, so feel free to ask me any questions. I'm also going to be chatting about a different topic tonight, so every night I kind of just chat about something, and then you guys ask me any questions that you have. So why don't we get started? I was going to talk about brain fog, because I know that's a common thing a lot of people experience. So let's talk a little bit about brain fog, and then if you're just tuning in, make sure to like and subscribe and join our health community here. Okay, so let's talk about brain fog. Now, brain fog, it's not a true medical condition or a medical term, but it's kind of a common thing that people describe, basically if they have difficulty with remembering things, and this is different from something like dementia or Alzheimer's disease. It's basically some people just say maybe they'll have difficulty getting their words out, or they're thinking of something and they don't know how to explain it, or perhaps they're just feeling a little bit fatigued and groggy, and then they kind of just explain that as brain fog. So let me know, is that something you experience? Because I hear that a lot, that people feel this brain fog, kind of cloudiness in their heads, kind of what they explain it as. So that's kind of what brain fog is. So as I mentioned, it could be with difficulty remembering words, or what to say. It could be fatigue, and it could be things like feeling groggy. So that's kind of the common things that I hear in regards to brain fog. So why don't we talk a little bit about what can help improve brain fog and why maybe you are experiencing the brain fog. So if anybody's just joining us, welcome. This is Let's Talk Health. I'm Dr. Amanda. This is our live health Q&A, so ask me any questions that you have, drop them in the comment box. I'm talking about brain fog right now, but you can ask anything. I get a lot of great questions on here. We have questions about stress, energy, gut health, skin health, so many different things like top remedies or different types of vitamins and minerals. So just ask anything that you want and I will answer for you.
Please inform about sleep paralysis.
Okay, so sleep paralysis. So not many people experience sleep paralysis on a regular basis. Sometimes it can be on a kind of here and there. So I would say for the first thing, if you're experiencing it every single night, then you may want to go get a sleep study done to see what's going on, to look at even the brain waves, the brain chemistry, see if potentially there's some sleep apnea present that could be contributing to sleep paralysis. If you're getting it here and there, sometimes that can happen. Some things that can contribute to it would be things like dehydration. So if you're not fully properly hydrated that day, that can impact your electrolytes, your mineral balance. So that would be one thing to look into. The other thing is looking into other underlying things like anxiety or stress. Could those be potentially contributing to your sleep paralysis? So number one, I would say if it's happening often, you want to get a sleep study or further investigation. And then two, look into your dietary and eating habits before bed, look into hydration, and then also look into stress and anxiety. Now, if you have any follow-up questions, let me know, but one thing that can be helpful is we want to kind of work on calming the nervous system and calming the body down. So I've talked about magnesium a lot on here, but the magnesium glycinate form, I'll write that down here. So this form of magnesium can be beneficial to take before bed. It's really nice and calming for the nervous system. It can help your muscles and your tendons and ligaments, everything kind of just relax. So that way when you're falling asleep and you're getting into a deep sleep, your body is more relaxed and calm. So that can be beneficial as well. And then it's good for like the nervous system in terms of relaxing the body mentally and physically. The other thing is you might even want to like experiment different sleeping positions. Like let's say you sleep on your back, and then that sometimes can happen where if you're in a certain position, it might trigger the sleep paralysis. So if you commonly sleep, let's say on your back, try sleeping on your left or your right side. So those would be my tips for you in terms of sleep paralysis. Thank you for your question. If you did find that helpful, just make sure to like this video, and if you're new here, make sure to subscribe too. And anybody else that's watching, welcome to the Let's Talk Health live stream. I'm Dr. Amanda. I'm a naturopathic doctor, and I host this live Q&A nightly just to answer your health questions, help you guys out. Of course, it's not medical advice, but it's just educational information, and I'm here to just help you out. So, okay, so that was a question about sleep paralysis. So, any other questions, drop them in the chat.
Ginkgo biloba.
Yeah, so in terms of Ginkgo biloba, we talked about this on a stream maybe a few days ago. So Ginkgo biloba is a herb. You can take this herb in different forms. So whenever we're taking herbs, there's different forms you can take them in. A tincture, which is basically a liquid extract. They use a little bit of alcohol to extract the herb with water, and that's in a tincture form. Or it can be taken in capsule form, where it's like a dried herb, or it can be used like in a tea or something like that. So generally with ginkgo, either the tincture or the capsules is a better form to take it. And the thing that ginkgo can help with, it actually, on the topic of brain fog, it could help with that because it's called a nootropic. So basically what it does is it supports the cognitive health, and it can help with blood flow too. So increasing blood flow to the brain. That's always important for helping with things like fatigue and brain fog and just cognitive like sluggishness or grogginess. So it is a herb that can help with that. Now that being said, with herbs we always want to be cautious because they can have side effects or they can interfere with medication. So if you're on a medication, just consider talking with your healthcare provider. Something like ginkgo or anything that kind of increases blood flow, if you are prone to high blood pressure or you have high blood pressure, you want to be cautious with that. But yeah, if you had a specific question about ginkgo, just let me know. But otherwise, it can be a helpful herb for brain fog, for fatigue, can help out with mental clarity and sharpness as well.
How many tablespoons of vitamin D should you take every day?
So you wouldn't be taking it in tablespoons. That would be a really high amount. So vitamin D, you want to look at every formulation of vitamin D would be a different formula, right? Every brand is kind of different. Generally, a standard dose is like, let's say 1 capsule or soft gel is usually about 1,000 international units of vitamin D, or like 1 drop is 1,000. Now, that being said, there are ones that could have 5,000 or 10,000 in each one. So just looking at what is on the label, so that way you know how much you're getting, because you could easily take too much of it if you don't look at the proper dose. So in terms of how much you should take, well, generally recommended by like the CDC or Health Canada is generally around 2,500 IU of vitamin D. A day is like a general dose for vitamin D. Now, that being said, some people need less and some people need more. And I've talked about this quite a bit, is get your levels checked. The blood test, it's very easy. So get your levels tested, so that way you know where you're at. Like, so the range of vitamin D depending on which units you're using to measure it, can range quite a bit. Kind of want to be in the middle of that range. So whatever your blood work comes back as, see where you are on that range, talk with your provider, but generally what you want is around that, but you might need more depending on what your levels are like.
What are the ranges?
So the range is, it's 30, I believe, to 100. That's the one that we use in the US. And ideally you kind of want it like a 50, 60. Some ranges go only up to 80, so you know, you don't really want it too much higher than that. That would be your, around that range is a pretty good level for that. In Canada, I can't remember the bottom of the range. I believe it might be like 70 to maybe 200, and you kind of want it around like 125 or 100, where that's the Canada range. Yeah, so that's kind of like what you would want your range. Now there are vitamin D calculators out there, and these can be really helpful, readily available on the internet. You can just Google vitamin D dose calculator, and basically what you're going to put in is your current vitamin D levels on blood work. You're going to put in how much vitamin D you're taking, and then what you would want like an optimal level to be. So let's say you were really deficient and you want to get it to a 40, a 50, just within that range. You're going to put that, and it will tell you approximately how much you should take every day. But yeah, great questions. Thanks for the questions about vitamin D. I know it's a really popular question because, you know, a lot of us don't have enough vitamin D. So if you found that helpful, just please sure to like this video. Make sure you're subscribing. Do turn on notifications, because I do go live every night. Timing varies. It's usually around this time. But make sure you are subscribed, and that way you know when I go live. And I do appreciate you guys. Thank you so much.
Are the supermarket's brand of vitamins good compared to the drugstore?
That's a really good question. And I'm going to say you want to get things that are from more for professional grade brand supplements. So something that you just pick up at the drugstore or the supermarket might not always be the best quality. And I talked about this in a previous video, what you should look for in a supplement, but basically you want to make sure that it's third-party tested. So we can write this down again. And that you can find on the brand website. You can reach out to them. You want to look at the quality or the amount as well, two different things, of the ingredient. You want to look at where the source is from, and then any fillers. So generally, if you're going to be paying a little bit more for a supplement with the professional grade brands, then you're most likely going to be getting this, whereas something that might be a cheaper one, you might not get it, but you could still. There definitely are brands that meet this criteria. That's one thing to keep in mind. And then if you're buying off somewhere like Amazon, I always recommend making sure that it's coming from the actual brand storefront, as opposed to like a third-party seller, right? So just like, let's say for example, there's a brand called Pure Encapsulations, okay? So if you're looking at Pure Encapsulations, magnesium, you want it to be from the Pure Encapsulation store rather than just from like a third-party seller. So that's just one tip to keep in mind. And then,
so third-party.
Sorry, not third-party seller, from just like a external seller. There's like sellers that can just sell things on Amazon.
That would be a third party.
Is that what it's called? Okay, yeah.
So you want it third-party tested, but not third-party sold.
Yeah, third-party tested is what the brand will get somebody to test it. Whereas like a seller, like say myself, I could go and sell something on Amazon, right? You wouldn't want to buy that from somebody, just anybody, because they could potentially change up what's going on in that formula. They could tamper with it, and you just want to make sure it's coming directly from the company. So third-party tested just means they get an external company to test their supplements for the quality rather than doing it in their own lab. The quality and the amount of the ingredient. So this kind of is hard for you to know unless you know exactly what's beneficial in each ingredient. So for example, a magnesium glycinate that I talked about before, like a generally good dose is 200 to 400 milligrams. And then you want it to be pure magnesium glycinate. You don't want something like magnesium oxide in there, because even if you see the front of a supplement, it might say magnesium glycinate, and you read the ingredient list and it can have some other magnesium forms in there. So you want to make sure that the source, so this is more so for things like herbs. Fish oil is a really important one. Like you want a good sourced fish oil, not just something like a tuna source. You want it to be sardines, anchovies, those are good source. And then fillers, so like anything else that they're adding in there, you want minimal fillers. Did I answer your question? Was there anything else in that question? Okay, so if that was helpful in terms of like supplements, please let me know. Give this video a like, I do appreciate it. Make sure you are subscribed as well. Join our health community here.
What about the interaction between vitamin D and calcium and vitamin K?
Yeah, so vitamin D, calcium, vitamin K, and magnesium are all kind of regulated and important for bone health in the body. So your body will balance things out. So generally for vitamin D, you can take it with a vitamin K, and that will just make sure that your bone is absorbing it properly. And then something like magnesium can also assist with that vitamin D. Calcium you can take as well, but sometimes calcium is better to take away from other supplements, especially things like iron, other minerals. Generally, calcium on its own would be good. So I would say all those are important for things like bone health and regulation of the way your vitamin D is absorbed.
Who do you recommend as a Canadian to do blood work? Family doc only does basic blood test, unless a problem is noticed.
Yeah, so I'm going to say I would recommend a naturopathic doctor. So, and depending on which province you are in Canada, there are regulated naturopathic doctors there. So I used to practice in Ontario. So Ontario is regulated. British Columbia also as well. Alberta, some of the other provinces as well. So just looking into that and where you are and seeing where you can find somebody. You can go to the, it's the CAND website, that's the Canadian Association of Naturopathic Doctors, and like find somebody in your area. So naturopathic doctors are great because what we do is we look beyond just like what the standard testing would be. The thing with your traditional medical system, and as I'm sure your medical doctors want to help you out, but unfortunately in Canada, in Ontario we have OHIP, and we're just limited by what we can do in terms of medical doctors, what they're allowed to test. So that's why they kind of just test the basics, and then if something else is going on, they might test more. So that's really where holistic medicine and naturopathic care can excel, because we get to listen to you, we get to hear what's going on, we get to spend like an hour with you, and then we can do more further blood work. So that's what I would highly recommend, seeing a naturopathic doctor. Personally, I say like, and I maybe just because I'm a naturopathic doctor, but I'd rather like see somebody that's a naturopathic doctor that's done many years of schooling, that is more trained on these things, rather than some other, let's say, health coaches or other holistic providers that maybe aren't regulated and don't have to go through expensive licensing exams and that kind of stuff to be a provider. So like, just for example, there's probably people that you see on the internet that might be offering services, so just be cautious about that kind of stuff. Yeah, but great question. I like that you're interested in learning more about your health and getting further blood tests. So If you guys are just joining us, hi and welcome. Happy Saturday night. I'm Dr. Amanda. This is Let's Talk Health. It's our live Q&A health chat, asking me any questions in regards to health concerns, dropping them in the chat box. I will answer them for you. Make sure you are subscribed and you turn on notifications because I do this nightly and I'd like you all to join me and be able to answer your health questions for you. All right, so we'll see if there's anything else, but we had some really good things already about brain fog. So I'm just gonna write those down because you guys brought up some good supplements. So vitamin D is good. We talked a little bit about omega when I mentioned the supplement things. So omega-3 and fish oil. These are really good for cognitive health, really good anti-inflammatories. So that's another one that's really beneficial as well. Another thing I really like is a B complex. So a B complex is basically your B vitamins, like B12, folate, B1, B2, all of your B vitamins, you'll find them in a B complex. And our body does use different B vitamins to go through different processes in the body. If we're getting really scientific on a cellular level, that's kind of what it does. So your body needs B vitamins, and it can help with energy and focus in a very gentle way. So a B complex is great. It can help with mental clarity if you're feeling that fogginess. It's good for that. Now, those are supplements. That's what I would say would be the top 3. But the other thing we don't want to forget is lifestyle things, right? So sleep. So you want to be getting 8 hours. Otherwise, you're going to feel fatigued, and you want it to be a good deep sleep. So going to bed when it's dark, waking up when the light is out. Of course, it's harder now it gets dark at 5 p.m., but that's really important, having a deep sleep. The other thing would be cardio exercise, getting the blood flowing, right? We don't want to have to rely just on supplements to do that. We want to physically get our blood flowing. So cardiovascular exercise is great for doing that, good for circulation, getting blood flowing through your brain, getting you to feel more clear. Those would be really helpful. What else can we talk about? We can talk a little bit about diet. So really what it comes down to, I would say, would be protein and antioxidants. My favorite, I always talk about berries. Choline is really important for the brain, and that's found in eggs. So that's a great one. Fish, we talked about fish is really important as well. And then things like even turmeric, ginger, anti-inflammatory stuff is great too. So that's what I would say, kind of if we're looking at brain fog, do something like this here. You focus on your diet, sleep, and get some cardio exercise. Vitamin D, omegas, fish oil, and B complex. So I hope that was helpful. If there's any questions about this, or if you have any other questions, just let me know. If you're just joining us, hi and welcome. I'm Dr. Amanda. This is our Let's Talk Health live stream. It is our live health Q&A. So you ask me questions, I answer them for you. Drop your questions in the comment box, and I will answer them.
Do we really need B12 supplements if we eat mostly carnivore?
You might, and again, it's one of those things that's an easy blood test, because even if you're eating carnivore, you're correct that you're getting the main sources of B12, whereas somebody, let's say, is on a vegan diet, they most likely would need to supplement with it because you don't get it through plant sources. But there could be an issue with absorption. So maybe you are eating enough meat and you're getting B12, but your body might not be absorbing it. And that does come down to your digestive health. We need optimal stomach acid in order to activate something called intrinsic factor, which helps with the B12 absorption. So if you are, let's say, eating it, I've seen this before where people are like, they eat a good amount of meat and animal-based products, but their B12 levels are still low. So I would say get your blood work checked. If your B12 is a good range, great. If not, then maybe you need to work on some sort of absorption control to help with improving your absorption. And then your levels might improve.
Where do you practice medicine? I just got promoted from ER to surgical team.
Oh, congratulations, that's awesome. I practice in California, so I'm in like the Sacramento area, so awesome. Thanks for joining us.
What should the dose
for-
of omega-3 be?
Yeah, so you want around 100 milligrams of omega-3. That's usually a good dose. Now, like, there's two forms of omega-3. There's EPA and then there's DHA, so just looking at that breakdown of the combination of the EPA and the DHA. But generally a good quality one would get you around 1,000 milligrams of omega-3.
Have you ever studied lion's mane mushroom for brain clarity?
Yeah, this seems like to be a popular one. I've been getting lots of questions about this. We talked about it a few nights ago. So yeah, lion's mane can help with brain clarity. It is another herb, like a mushroom herb. What else can be there? Like reishi is also good one as well. It can be beneficial. So yeah, it can be helpful. Again, just with things like mushrooms and stuff, cautious with where you're getting those from, where they're sourced from.
How does it work?
So it can help also improve the blood flow to the brain. It can also help with the connection between your neurons, just like helping to improve that connection. And it's also great for the immune system. So whenever we're working on regulating like immunity, anti-inflammatory, it kind of all works together. So that can be a benefit as well. But thank you everybody for the questions. It's been great. And as I said, if you just joined us before or if you're joining us now, welcome. Thanks for tuning in. Thanks for listening. This is Let's Talk Health. If you're new to my channel, be sure to subscribe and join our health community here.
What would you recommend to get to sleep faster?
Yeah, so there's a few things for sleep. If we're looking at something like, let's talk about different ranges of things, like on kind of like the most calming end to things that might be a bit more stronger. So something really gentle. I'm going to talk about magnesium again, but honestly, magnesium glycinate is one of those ones that's really great for helping sleep because it helps to calm down the nervous system. So that's one thing that's, you know, pretty readily available, generally safe for most people to take, but of course, it's not medical advice, so just double check. But that can be pretty beneficial for helping calming the nervous system for sleep. Then we can look at things like herbs, things like chamomile, passion flower, valerian. These are herbs that can be beneficial for calming down your nervous system, making you feel a little sleepy, helping you go to bed. So that you would want to take an hour before bed. And then on the other hand, like kind of like the last thing I would say would be like melatonin. Just because melatonin, it's quite strong, it is a hormone in the body, so we don't want our body to become dependent on it, and sometimes it can cause grogginess or vivid dreams for some people, so I always recommend just doing like a very low dose, like 1 milligram or 2 milligram. But yeah, that's what I would say in terms of helping out with sleep. The other thing is like looking at your lifestyle. What's your sleep routine like before you're going to bed? Are you on your phone a lot? Are you watching TV? Are you on your computer? Those are things that can interfere with sleep. So avoiding those like an hour before you go to bed. And doing something more calming and relaxing, maybe listening to a meditation or even listening to an audiobook or just doing some reading on with a book or something like that. Yeah, great question. I think we get a lot of questions about sleep and like cognitive health. So you can always go back and watch some of my previous lives as well. I did talk about that, but I think I pretty much explained it as I did before. So thank you for the questions. And if that was helpful, make sure to like this video if you're watching and you found this helpful. Make sure to like it, subscribe, and join. All right. I think that was everything about brain fog that I wanted to mention. Deep sleep, vitamin D, fish oil we talked about. We had a good question about that. Oh, just with the B complex, if you've ever taken a B complex before, it can turn your urine that like really bright yellow. It's completely normal. It's just one of the B vitamins in there that does that. So that's just something to keep in mind. Vitamin D, it is fat soluble, so that means like your body will store it. So just being cautious with how much you are taking. That's why I always recommend getting your levels tested. What else? Diet is so important. Choline, really good. It's in eggs. That's pretty much your main source of choline. So eating eggs, you could take choline as a supplement form as well. Fish, turmeric, ginger, all of these. Cardio, sleep. Yeah, that's what I would say. That would be my little summary for brain fog. I don't think we're missing any categories about lifestyle, supplements, and diet. I always like saying whenever you're approaching a condition or you're approaching an issue that you're having or a symptom that you're having, you want to like have a whole approach, right? Like, yes, supplements are great, but then if we're just treating with supplements, like, is that similar to just treating with medication? Like, we want to make sure we're doing things like diet and lifestyle things to also target. So whenever I'm working with somebody, we do a combination of things, like not just one thing, not just taking one supplement or just, you know, eating one food, kind of a combination of everything. But okay, so if you're just joining us, hi and welcome. This is Let's Talk Health. I'm Dr. Amanda, naturopathic doctor here, just to answer any health questions you might have. I will be hanging out for a few more minutes with you guys to answer any of your health questions or concerns. But if you're just dropping by, make sure to like and subscribe. Every night we talk, we go through different health topics, I answer your questions, and it's great because if you ask a question, it might help out somebody else that's experiencing the same thing.
Theamine is super underrated for brain fog. Theamine is super underrated for brain fog.
Yeah, so you would find that in your B complex. So that's why I said like all your B vitamins are really good. Yeah, for sure. It can, a lot of things, yeah, might be underrated, or maybe we don't know much about them, and just kind of like the popular things come out and we hear about those a lot. So, you know, there was like a big craze with like colostrum and not too long ago. And then there was a craze with like sea moss gel. Like sometimes like these things we hear about, and are they really beneficial, or are they just more hyped up? But yeah, you're right, there are things that maybe we don't know about that can be beneficial. But yeah.
How much vitamin D would you recommend? I'm a male, mid-30s.
Okay, so I just talked about that like maybe 15 minutes ago, so I'll mention it again, but you can always go back and watch that. So as I said with vitamin D, the general dose that's recommended is 2,500 IUs a day. Now, that being said, that's kind of just like a base dose. You may need more, you may need less. So I would recommend getting your levels checked. Just go do a simple blood test, see where you're at, and then if you're on like the lower end of the range, you might need more. If you're on the upper end of the range, then maybe you don't need as much. But that's kind of just like the general adult dose to take every single day. I did make a point where you could actually go online and Google vitamin D dose calculator. You can even do that right now. Just do a quick Google search, and there's one by Grassroots, is like the website, and you can put in your vitamin D levels in your blood. You can put in what your current dose is, and then your weight, and it will tell you how much you should take to get to a certain level. So that's probably the best way to find out how much vitamin D you need. But as a general, that's a pretty general dose. Yeah, great question. A lot of questions about vitamin D, and it is an important vitamin. So I'm happy that you guys are all, you know, curious about it and curious about how much to take, because a lot of times we have to be careful with things that we take, right? Like even if they're considered vitamins and minerals, we've got to be careful. We don't want to take too much of something. So it's good that you're being informed and you want to know how much to take. Okay. Yeah, so if anybody just joined us, welcome to Let's Talk Health. I'm going to hang out here for a few more minutes. I'm Dr. Amanda. I do this every night where I just answer your health questions. So if you didn't get your question answered today, or maybe you didn't have a question today, drop back in tomorrow or the next day, and I will answer your questions for you. Okay.
What do you do if you're a server and have arthritis in the hip? What supplement should I take?
Oh, yeah, that's tough because, like, the main thing I would say is, like, to try to give yourself a break if you're able to. If you could, rest on your days off, go to physiotherapy or chiropractor just to have things assessed, to get some proper exercises and stretching. Do things like hot and cold packs that can be really beneficial. And then if we're talking about things like supplements, you can do things topically and then you can do internally. So topically, some great things are arnica gel. So I'll just write this down for you. If you've never heard about arnica, it can help a lot with like bruising and pain and muscle aches. So arthritis pain. So what I said was physio, massage, that kind of thing can be very beneficial, and then like stretches, hot cold therapy, and then for topical, I usually like, as I mentioned, arnica, magnesium gel is another good one. And then castor oil can also be really good because it's anti-inflammatory. And then if you're looking at things like supplements, usually anti-inflammatory herbs are really good for helping with just general inflammation and reduction in the body, because arthritis is an issue where there is inflammation, the bones are rubbing together. Now the thing is like, it's hard to kind of reverse something like that once that damage has been done. The way that just like your bones and like the joints are just kind of run down, so you can't really go back and like improve that. Sometimes you have to get surgery if it's really, really bad. But what you want to do is just be a bit cautious, give yourself time to like rest and heal. And then, so turmeric is a good one. And then boswellia as well. Swimming is actually really good for arthritis hip pain, because you still want to make sure you're moving, right? But you don't want to be doing something that's going to aggravate it. So like usually running, sports and stuff like that probably wouldn't be the best, but swimming is really good because it takes that pressure off of your joints, and you can like still move your hip nice and freely. But yeah, if you had a follow-up question, let me know. If you found this helpful for arthritis pain, feel free to like this video. And if you're new here, feel free to subscribe and join our community.
I used to take vitamin D supplement 60,000 IUs once a week for 8 weeks for the deficiency, but now it's fine. Can I take those 60,000 IUs once a month? I'm too lazy to take small quantities every day.
Yeah, that's such a good question. So with vitamin D, you can do something like that where you do a loading dose. So basically 60,000 over a week is just under like 10,000 a day, right? So that is on the higher end to take something like 10,000 a day. If you were low and you were deficient, you were told to take that much, then that's usually okay. But you could do a loading dose like that because vitamin D is fat soluble, so your body does absorb it and like holds on to it. So yes, something like that could be done. Again, like I can't tell you specifically like to take that, but you can check with your healthcare provider. You can check what your levels are now and see what they're like, and you could do something like a loading dose every week. Every month, usually weekly is better than monthly, just because you probably wouldn't get enough if you just did every month, but maybe like once a week. If your levels were good, you need to take like 10,000 a week. Usually that's okay. Great question.
I have bloating and discomfort. I first had grade 2 fatty liver. After that, I lost weight, and now the reports are coming normal. But I still feel bloating and discomfort. I've consulted several doctors, but nothing happened.
That's so good. So I'm so glad that you were able to, lose weight, help with reducing fatty liver. That's honestly one of the best things for helping with fatty liver is just weight loss can help with that. So that's awesome. Now, bloating and gas can be due to so many different things. One thing I would think of if you had fatty liver and it sounds like maybe liver was sluggish, potentially a sluggish gallbladder. I'm thinking more so digestion, so like maybe you need some digestion support. And then also assessing your diet. Are you having a lot of fatty and greasy foods? That can definitely lead to bloating. Are you having a lot of raw and uncooked foods like salads and raw veggies? Can cause gas. So in terms of digestion help, even something like a digestive enzyme can you take it before you eat and can help you with digesting your food better. So that way your body is able to digest it and you're not left with bloating and gas. So that's one thing to think about. On the other hand, if you're constantly bloated, and maybe even if it's like you're waking up bloated or you're bloated away from food, then you might need to look into if there's a bacteria overgrowth or something else going on that could be contributing to that. But if you have another question in terms of the follow-up, just let me know. And if anybody's just joining us, hi and welcome. Happy Saturday night. I'm Dr. Amanda. This is Let's Talk Health. We've had some really great questions tonight. I appreciate all of your questions, you guys. So make sure to like this video and subscribe and join our community here. We've had so many questions about vitamin D, gas, bloating, arthritis. We talked a little bit about brain fog. So really lots of different topics here that we're chatting about.
How much turmeric do you need for an effective dose? I'm sure they come in capsules.
Turmeric comes in capsules, various different forms as well, like in terms of each capsule might have a different amount. Around 1,000 is generally okay for milligrams for turmeric, but sometimes it can even depend on the way the herb is extracted. So just like looking at the label, because sometimes it will be like a different ratio than other ones. Herbs are a little bit different than something like a supplement or a vitamin or a mineral because of the way that they're extracted. So again, generally what the company says listed on there as like their recommended dose is probably based on like their own formula. Sometimes turmeric will have a little bit of black pepper in there too to help with absorbing it as well.
Can you explain what is inflammation and why it's bad for us? How would we know whether we are inflamed or not, and how to fix it?
So inflammation is one of those things where it can actually be good at low levels, and then if it gets to be long-term, then it can be an issue. So your body, your immune system and your body will produce in what we call different cells and stuff to help with noticing if there is something wrong in the body. So like, let's say for example, you get cut, okay, and you're gonna get a little bit of inflammation from that, but that's your body's natural response to healing is inflammation. You have an injury, you're gonna get inflammation, that's your body's natural response to healing. So that's okay if it's short term and then it goes away. Chronic inflammation can be due to things like diabetes, cardiovascular disease, we talked about fatty liver, an imbalance in your gut microbiome. All of these things can lead to long-term inflammation, and basically what that means is in the body there's high levels of, let's say, inflammatory markers. So you can check this on blood work. There's something called CRP, so that would be one way of knowing. For example, in the gut, there's a marker called calprotectin. That would show us there's levels of inflammation going on in the gut that can be sometimes found in things like Crohn's or colitis. So those are some markers that you can see for inflammation. liver enzymes elevated is showing us that there's an issue with the liver. Can be, again, inflammation is just kind of a word of telling us that there's something going on that is out of the normal and it shouldn't be there, and your body should be able to, you know, have a response where it's able to come back from whatever inflammation is going on. A lot of times it's like long-term neglect of certain conditions. So like, for example, diabetes, high blood sugar, that is a form of inflammation in your blood. Your blood always has too much sugar. That can cause issues in the body, it can cause issues with sleep, can cause issues with your hair, can cause issues with your energy levels. So I hope that was helpful. Was there a second part to that question?
Does drinking beer 2 cups a day help get brighter skin?
I've not heard about that. That I'm not
or any
sure.
other drinks?
I wouldn't, I'm not sure about beer. You know, I'm not sure about that, but in terms of things that can help with skin, actually green tea is pretty good for helping out with skin. Now, if you're sensitive to caffeine, you can always do the decaffeinated green tea, but green tea on its own has very minimal caffeine, so green tea is a very good one for helping out with skin health.
Is there a difference in capsule turmeric and the one used in cooking heat?
Yeah, so generally the ones in capsules are going to just be a much higher concentration because they're like taking that turmeric root, breaking it down, and like putting it at a higher concentration. That's generally with supplements. You're going to find a higher concentration than what you would find, but having it from a whole food source is really beneficial as well because you're getting it directly from the source. So you could even do both, and that way you're getting the benefit of both.
Hi, I live in Atlanta. Who do you recommend to get blood work? Also, do you have an office in Atlanta, Georgia? Can you recommend a good osteopathic in Atlanta?
Hi.
Pierre Sanon.
Thanks for joining us from Atlanta. So I'm in California, so unfortunately I can only see patients that are residents of California. But what I would say is if you're looking for a naturopathic doctor, go check out the AANP, that's the American Association of Naturopathic Physicians, and then find somebody in your area. So you can find a naturopathic doctor in your area that's close to you. In terms of osteopath, I'm not familiar with any osteopaths that are there, but I'm sure osteopaths have an association as well, and you can check them out there. Now that being said, like this is always good to check this website because they're going to be regulated, they're going to be licensed, and you're not just going for a provider that maybe says they're a naturopathic. Because I believe in Georgia, I don't know if it's fully regulated, so sometimes the title is not protected, which basically means people can call themselves naturopathic doctors and it might not actually have gone through the same extensive schooling. So I know, for example, in California, it's a protected term, and only people that have gone through that schooling and gone through the testing can call themselves naturopathic physicians. So.
Which food should be avoided for diabetic patients?
Last night I did, my main talk was about insulin resistance, so you can check that out in terms of seeing like how to have balanced meals, which can be beneficial. But really when it comes down to diabetes, we're thinking things that are going to be high in sugar. So any sort of cookies, candies, processed foods and sweets, you want to avoid having those. So anything that's high in sugar. And then on the other hand, things like that are called simple carbohydrates, what we call like flour and bread and like pasta and rice. They don't have much fiber, so they're simple carbohydrates, and those can also spike blood sugar. Okay, so everybody, thank you so much for joining tonight. We had some really great questions, and I really appreciate it. So make sure to like the video, make sure to subscribe, and I will be back tomorrow. If you didn't get your question answered, come join me tomorrow, and we will do this again. Have a great Saturday night.